Welcome to Ready to Talk, Ready to Listen, a podcast about all things mental health. CHE Behavioral Health Services interviews guests as they discuss relevant mental health topics and speak with our industry's top leading trailblazers. Let's get started discussing behavioral health and ways to support our mental well-being.
Hi, this is Dr. Mayra Ortiz here. I am a co-host of the Ready to Talk, Ready to Listen podcast, where we feature top experts and leaders and those interested in behavioral health care and mental well-being. I have Chad Franzen here of Rise 25, who has done hundreds of interviews with successful entrepreneurs, investors, and CEOs. We have flipped the script, and today he will be interviewing me. Chad, welcome to the podcast.
Hey, thank you so much, Dr. Ortiz. I'm looking forward to talking to you. Before we get started, I'll let everybody know that this episode is brought to them by CHE Behavioral Health Services. CHE offers comprehensive mental health care solutions, including in-person and telehealth psychology and psychiatry services. Americans are experiencing greater stress, anxiety, and depression than ever before. CHE's mission is to provide access to care and support individuals to improve their quality of life and emotional well-being. They have over 850 professionals committed to providing gold standard and evidence-based behavioral health care. To learn more about CHE or to book an appointment, please call them at 888-831-2618. That's 888-831-2618, or visit cheservices.com. Hey, Dr. Ortiz, it's great to talk to you. As we get started here, tell me what you do for CHE Behavioral Health.
So I'm one of the many clinicians for CHE. I'm a provider. I also am a mentor for approximately 33 mentees in CHE Behavioral Health. And I've been with CHE on and off since 2014.
What brought you to CHE?
So they actually reached out to me. They found me and invited me to join this incredible organization. CHE is actually my favorite group that I have worked for. And, I've been doing a lot of work with Latinx, but I also treat, all kinds of population.
So tell me kind of what your specialty is. Why would a patient or a client visit with you?
So as I said before, I actually started in skilled nursing facilities with CHE, and I worked probably for a good 4 or 5 years just in skilled nursing facilities. And then I needed to leave CHE because my husband needed to move here to the state of Georgia. And but then was the pandemic and the telehealth availability. They invited me to come back. And I'm very, very pleased that, I was able to join this incredible organization. I see a lot of Latinx, but I also see a variety of patients of all kinds of race and ethnicity background.
Tell me a little bit about EDI. What does EDI stand for, and why is it listed as EDI?
So most of my work is really in EDI. That's actually a portion of my job is really on EDI. I do a lot of training, presentations on EDI. EDI stands for Equity, Diversity, and Inclusion. In equity, if we take each one of those words, first of all, equity refers to providing resources according to the needs of that particular population. Diversity actually refers to the differences, acknowledging all of the differences of our background. So when we talk about diversity, we are talking also about intersectionality. And intersectionality refers to, it proposes that people are categorized in a socially created category of domination or oppression. And that is based on age, gender, socioeconomic strata, so each one of us, even if we are people of color, we are still within that intersectionality. There's something that is, is always changing. Inclusion refers to embracing you just the way you are, welcoming you with your style, your perspectives, and, so just the way you are. So that's what it stands for. We are placing in the American Psychological Association, we are placing much more emphasis right now on EDI because this society is becoming, increasingly more pluralistic and diverse.
What is, you talked about equity a little bit. That's pretty interesting. What is health equity, and how does it impact people who are receiving the types of services that you provide?
So I'm going to actually go a little bit back here, people sometimes confuse equality and equity. And the difference between the two terms is that when we talk about equality, we're talking about the same kind of, that everybody gets equal proportion of resources. But when we talk about equity, what we are talking is that people get the resources according to their needs. And this is very important, when we are talking about, people sometimes in this society not getting the services that they need. Health equity refers to, giving people the fair opportunity to be as healthy as possible. This is a big concern in our society right now because there's many people that need the mental health services and they don't have it. It could be because of insurances, where they are located. So, telehealth services actually is an incredible invention in many ways that, we give us the accessibility to reach out those people that are places that is more difficult for them to get the mental health services that they need in person.
What can be done to improve that?
So, there's many things, that we could do. First of all, we need to do more advocacy for, health equity. This is one of my biggest passion, going to Capitol Hill, trying to advocate that people that are in need get the services, that they need. There's many rules, there's many things that happen, that people, based on their insurances, they may not be getting those services. So we need to advocate more so that people continue, even post-public health emergency, that they continue receiving the services that they need through telehealth. And I'm going to give you an example of that, Chad. An example is that, one of the new rules that we think that are going to happen with Medicare is that people that are not advantaged, that they are only Medicare, may be affected with the telehealth services because you need to see those patients in person after 6 months. There's a lot of things that are happening even right now, but some of those people may be affected. Me, for instance, that I see a lot of patients in the state of New York, but I live in Georgia. That means that, for me to do services in person is more difficult for me to get to New York, being in Georgia in person to see patients. We want to make sure that the services continue for those patients, those clients that are in so much need.
Is cultural sensitivity a big part of your job, and maybe helping train other people to be culturally sensitive?
Right. As I said before, as this, nation becomes more and more pluralistic, more diverse, this is a big concern, training people to be culturally sensitive. And the reason is that when you do not have that training, you may say something that you don't really mean, but, it may lead to a misunderstanding or misunderstanding in the diagnosis. And it may lead to premature termination of services. So when we talk about cultural sensitivity, what we are talking is about something that the APA calls the multicultural guidelines talk, that is called the tripartite model of multicultural responsiveness. And that is awareness, knowledge, and skills. We want to be aware of our own biases. We need to be aware of our own cultures. Knowledge, understanding, being more open to understand the culture and the background of the clients that we are serving. And the skills is something that we are continuously developing, right? Using the appropriate interventions that are culturally sensitive to provide the services of those clients that we are seeing. So this is overall, the Latinx are very important here because, the Latino population, they are 18%. This is according to the census 2020 right now. We are like 18% of the population right now. And it just grows in a faster rate. Between 2010 to 2020, the Hispanics, the Latinx grew in this nation by 23%. So as you see, it's the fastest kind of growing group. We want to make sure that, we are competent enough to treat this diverse, the population that we are serving.
Sure. When you talk about Latinx, can we kind of define what the Latinx, who constitutes the Latinx population, and maybe how it's different than Hispanic, the difference between Latinx and Hispanic?
Right. So people confuse a lot, the two terms, like they don't know, is it Hispanics? Is it, Latinx? So the difference is that the Hispanics refers to the language that you speak, which is Spanish, but also people from Spain. If you're coming from Spain, then that is Hispanic and you speak Spanish. Latinx refers to Latin America and Central America and also some places in the Caribbean, so those are the Latinx. That includes people from Brazil, even though they speak Portuguese, but they are considered part of the Latinx community.
And let's talk a little bit more then about how you train people to become more culturally sensitive. You mentioned awareness being one of the key parts of that. How hard is that people to find? And do you ever have people say, well, I don't have any biases? And would you say that that's usually true, that they don't have any biases?
Well, we all have biases. All of us have biases. We need to be aware of it. We need to recognize where we are standing at and respecting differences. What I say to people is that even when you are married, right? You may have a reality, a way of thinking, and that other person have another reality on the way of thinking, and it's actually acknowledging the reality of each other, respecting that reality, respecting that differences. So, we all have biases. The awareness is just the beginning of walking there. It's just realizing where you're standing at. Knowledge comes into understanding that the culture, what is a sociopolitical impact on that, particular, person, that client that you are seeing. And the skills we are continuously, and that includes me, we are continuously learning and growing. That's why, I like the work of Pamela Hayes, Dr. Pamela Hayes. She has a book by the name of Addressing Cultural Complexities in Practice, and she talks about 4 things to become culturally sensitive, and to be open to that. And that is humility, compassion, critical thinking, and courage. So we need to actually be open to that and examine where we are, have that humility, and compassion, so that we can understand the population that we are serving.
So it's important to have humility and compassion. And then how does critical thinking work into that?
So, you need to be critical. You have to have you have to think in a critical way so that you can analyze that, where you're standing at. So it's just like this openness, to actually understand, where you're standing at. There's a different chat between being clinically competent and being culturally competent. And the clinical competence actually is more culturally bound and it's based on the values of the mainstream, whereas cultural competence is more inclusive and it acknowledges differences how they are, and also, the EDI, inclusive language guidelines of the APA defines cultural competence as, be effectively working with people from different cultures. And that's really the goal. That's really what we want to do.
Would you say that there's a great need for improvement in cultural competence, or are we really improving as a society in that respect?
I think that there's a lot to be worked on, and there's training that is necessary. One of the reasons is that not every state really requires, continued education in multicultural competence. And that has been one of my biggest concerns as this population becomes more pluralistic. Independently of being Latinx, you need to make sure that you are sensitive to the patients that we are serving.
So what is it? What would you say with regard to diversity causes people to leave treatment?
So there's, for example, NAMI actually published something in 2021 where they talk about the barriers for people leaving or not accessing services. And in that you have the language barrier, if you speak Spanish and the client speaks Spanish, or, it could be any other language, because it's such a diverse, nation, but language is a very important thing. Also, the other one is, health equity, if the patient has the accessibility of the resources and the insurance as to, get the services that they need. Lack of sensitivity in terms of cultural competence, that's the other one. The acculturation, the level of acculturation of the Latinx specifically, where they are standing. And I talk a lot about that. When I do, I have done presentations where I talk about acculturation with the Latinx and I give examples, why this could, we need to be aware of that when we are delivering services. And then we have the stigma. And we, in the Spanish community, we have a saying, la ropa sucia se lava en casa. La ropa sucia se lava en casa. And what that means is that, the dirty clothing, you wash it at home. And what it means is that the Latinx they work more as a collective, as a group, It's not something that is more independent and it's not individualistic. They don't place a lot of emphasis on individualism. It's more collectivism. We work all together. So we want to work together. That's what family system theory, family psychotherapy is so effective and so good for treat the Latinx population.
So if you could just kind of break that down a little bit more, why is that collective mentality or that collective culture, how would that affect you differently if you're going to maybe treat somebody who's an American, maybe more independent compared to somebody from a collective culture?
So I'm going to give you a concrete example about that.
Okay. Great.
I had quite a few years ago, I was going to treat, I also, I've been trained even in child, I've been a child psychologist as well, because from my training, my background training, I actually started with children. But because I speak Spanish, I started expanding all over the spectrum to even treating older adults. So quite a few, like a couple of years ago, I had a family. This is when we were still doing, so this is more than a couple of years ago because it was before the pandemic. And I was going to see this child. And, as the protocol, I see first the family before I'm seeing the child that is going to be my patient. And what happened was that I scheduled the parents so that we can talk first, what were they seeking treatment and what were the goals for treatment and what were their concerns. And when I opened the door to receive, they are waiting in the waiting area. When I opened my door to receive the family, the mom and dad, I see all of these people sitting there. They were all for my patient. All of those people that were sitting there were for my patient. And I did not rejected them. I did not, I brought everybody. You could see, like the uncles and all family relatives. Everybody wanted to be involved in the treatment of the child. And I did not reject them. I understood that, in the Latinx culture, things are seen, any problem is seen as a family and the family wants to be included. It's about inclusion, So thereafter, I discussed with only the father and the mother how they wanted to proceed because of HIPAA. And I just wanted to make sure that I was respecting confidentiality. And then they signed consents. But I'm very sensitive to understand that, in the Latinx, this is actually the way that things are seen.
My last question for you is how has telehealth kind of affected you, and how has it affected health equity?
So, as I said before, one of the biggest problems that we have right now with telehealth is that post-public health emergency, I hope that we can continue, that we are not affected, that our fee schedule is not affected. We need to understand, and this is why advocacy is so important at the, state level and nation level. APA, the Political Action Committee, does a lot on this. And I'm one of the persons that actually, work on that as well, to make sure that our patients continue receiving services, the telehealth services, as as services that are in person. They could be they are very useful. It allows us to reach a big extend the services to people that otherwise they cannot get the services. Take, for instance, the fact that I speak Spanish, and now, through telehealth, I can just access communities, people that otherwise they may not be able to come in person, to get those services. So this is very important to me. That health equity is extremely important to me, and it's something that we are fighting, in APA overall, so that those services would not be affected,
Okay. Hey, Dr. Ortiz, it's been great to talk with you today. Is there anything else we should know about your work with regard to EDI and the Latinx community?
Listen, I could be talking for hours. You don't want, you don't exactly want that. But I do trainings, I do presentations, I constantly doing continuing education, even for other states. So I'm very honored and humbled that I've been invited, and thank you so much.
Thank you, Dr. Ortiz. It's been great to talk to you today on the podcast. Thank you very much.
Thanks for joining us in this episode of Ready to Talk, Ready to Listen, all things mental health. Click to subscribe to our podcast on iTunes or Google Play. Until next time.